Hari Om, Shri Gurubhyo Namaha. Yesterday, I uploaded a video in Tamil regarding male infertility and the treatments that we give in Bharat Clinic and Viva Ayurvedic Center. Some of my friends wanted this video in English, so here it is. Male infertility usually has a lot of causes. Basically, first comes the count. The person has to have a very good count, a good morphology, a good motility, a good liquefaction time, and so on. So basically, in Bharat Clinic, we ask for at least 60 million count with 50 percentage rapid progressive motility and a 50 percentage normal morphology. This is not seen in most of the men. Only because it is not there, they come to us. So, other than the count, morphology, and motility, there can be some problems with liquefaction time. The liquefaction time can be very high because of the viscosity being high, or the liquefaction time can be very low. This needs to be addressed. We say that when the pitta's saraguna increases, the liquefaction time actually becomes very less, and many other things like that. So, first comes the count. A sure short count that we aim at is a 60 million count per ml, not per ejaculate, it's per ml. And the second one is the rapid progressive motility. We aim at 50 percentage rapid progressive motility, and we also aim at a 50% normal morphology of the sperm, that is the head, neck, body, and tail of the sperm is anatomically correct, morphologically correct. That is what we aim at. There can also be other problems with volume. Some people will have lesser volume, some people will have very high volume. So there can be some debris cells in the sperm, many pus cells, other epithelial cells. Sometimes even RBCs can be seen, that is red blood cells can be seen. All these can be addressed with Ayurveda, and we have been very successfully treating this condition, all these conditions, especially the male infertility conditions that I've been talking about now, at Bharat Clinic and Viva Ayurvedic Center. And one standalone treatment that we have for this is called as BASTI. BASTI, basically, to be very crude, I can say it is something like an enema. That is, a transrectal route of administration of medicine is done. Medicine is taken and it is given through the rectum of the person. There is no pain, no discomfort involved. Maybe after some time the patient will pass motion. That's all. But when you give BASTI, why I use this as a standalone treatment in male infertility is Ayurveda has a concept that when you have a problem, the medicine has to be given through the nearest route, natural route that is possible. Basically, male infertility is concerned with the reproductive organs, and naturally, the route, easier route, which is available is the transrectal route. Some of you might ask, why not give medicine directly through the penis? Yes, it is possible. We will be able to give medicine through the phallus, but sometimes it's a painful procedure, and it is also called as Uttaravasti. This video is not about that. We are going to talk about Basti. So Basti has various types of Bastis. Out of that, there is something called as Matra Basti and something is called as Kashaya Basti. There are various doses that we can give. The same medicine that we administer through the mouth. Maybe if I'm able to give some Kashayam, 10 ml of Kashayam or 20 ml of Kashayam. When it comes to Basti, we will be able to give doses anywhere between 60 to 100 ml to 1000 to 1200 ml. Obviously, not everybody can be given 1000 ml dose. There are many things that we can consider, we have to consider. But when a Matravasti is given, easily 100 to 150 ml dose can be given. Just compare giving 10 ml of Gritham, an oil or a medicine which is made up with ghee, giving 10 ml and giving 150 ml through Basti. Obviously, the dose is more, and I'll come to the absorption later. In Kashaya Vasti, the other type, where we can give even 1200 ml of dose. Imagine an ordinary Kashayam that we give through the mouth is given maybe somewhere around 20 ml. That is the usual dose. But here we can give even the total Vasti is somewhere around 1200 ml. But practically speaking, nowadays people are not able to have that kind of a dose. So a minimum starting dose is somewhere around 500 to 600 ml. Even if you consider 600 ml, where is 20 ml and where is 600 ml? Obviously, more the dose and more the dose is being retained by the person in the rectum, more will be the absorption. Because the rectum will have a ballooning effect when I give this medicine, and it will start absorbing the medicine, especially when this transrectal route of medication is given. It bypasses something called as first pass metabolism, because the lower end of the rectum has such kind of blood supply that medicine, at least 1/3 of the medicine that I give, is absorbed directly into the circulation. It does not go through the liver. This is called as bypassing the first pass metabolism. While when medicine is given through the mouth, the oral administration, a lot of it is lost when it goes through the first pass metabolism. So this is a very big advantage, and that is why I use Basti in a scientific way with extreme success in my clinic. So this is able to address of course, the medicines are different for count, different medicines for morphology, different medicines for motility, and so on, liquefaction time. There can also be other problems like premature ejaculation. The sperm will just come out very fast, even though the erection is good. There can be other problems like erectile dysfunctions, and there can be other ejaculatory disorders like anejaculation. How much ever the patient goes for intercourse, he will not be able to ejaculate. All these can be addressed with the standalone treatment called as Basti. But the medicine will keep differing in the Basti. So this is what I wanted to share with you guys. Ayurveda gives excellent treatment for male infertility, and we have been doing this very successfully in our clinic. So thank you all. I'll meet you all soon with another video.